a safe night. We thank you that there will be no technical difficulties. And we pray, God, that we would have a great time here tonight. So we give you thanks in Jesus' name. Amen. You may take your seats. So the Barbados Physical Therapy Association has joined with physiotherapists around the world in educating the public about the focus theme for this year, which is low back pain. This evening, we have a team of qualified physiotherapists who are eager and ready and willing to share with us on various topics. Low back pain as it relates to pregnancy, lifting and handling, ergonomics, sciatic symptoms, and sex. It promises to be a very informative night. So I invite you to please sit back, relax, fasten your seatbelts, and please place your phones on silence or airplane mode as we get ready for takeoff. Okay? All right. So to get tonight's lecture started, we will be hearing first from Miss Jaleesa Brewster and Miss Trudy Bulling. So I'll just tell you quickly about them. Miss Jaleesa Brewster is one of our youngest presenters tonight. She graduated from the University of the West Indies, Mona campus in 2020. And she has worked as a physiotherapist in both the private and public sector. She spent 3 years working in St. Vincent and the Grenadines, but then returned to Barbados in 2023, and presently is working at the Warrens Physiotherapy Clinic. She loves her profession and enjoys educating individuals on taking charge of their health. Ms. Trudy Bulling holds a BSc and MSc in physiotherapy and is an energetic physiotherapist with 9 years of experience in her physiotherapy practice. She's a member of the team of physiotherapists employed by the Queen Elizabeth Hospital. Trudy is the secretary of the Barbados Physical Therapy Association and is an avid musician. Ladies and gentlemen, Miss Jaleesa Brewster and Miss Trudy Bulling.
Good night, everyone. I am Trudy Bullen, and this is
Jaleesa Brewster.
We are here tonight to give a brief explanation of the anatomy of your back, pain, and the conditions that you would experience with lower back pain, and what your physiotherapist or exercises can do for your back pain. In general, what do we see? Tonight, I want you to keep in your mind, you are not just what is on the outside. We have things inside, where you will see muscles, you will see bones, and everybody that's speaking to you tonight, they will speak to you on your body. So what you see, it goes deeper, and we just want you to remember how you are built and made up. Tonight, we will also be hearing a lot of terms. So we're just letting you know that if you see or you hear LBP, this is lower back pain. ROM is range of motion. You would hear about your L spine more so, but you may see C, T, L, or S, which means cervical, thoracic, lumbar, or sacral spine. PT, as you may know, is physio or physical therapy. They may mention some form of medication and NSAIDs, non-steroidal anti-inflammatory drugs, and your QOL, which would be your quality of life. Jaleesa will now explain your anatomy.
Good night. So we're going to briefly talk about the muscles that are found in your back first. So there are 3 layers of muscles in your back. There is the superficial, the intermediate, and the deep. So superficial muscles are associated with movements of the shoulder, while intermediate muscles are associated with movements of the thoracic cage, and the deep muscles are associated with movements of the vertebral column. So the superficial muscles are muscles that you will more so hear about in your day-to-day. You will hear about the trapezius or the traps. You may hear about your rhomboids, rhomboid minor, rhomboid major, and you'll hear about your lats, better known as latissimus dorsi. You also have deep muscles of the back, and these are also divided into 3 layers. There's the superficial, the intermediate, and the deep layer. We also have the vertebral column. So the vertebral column has 4 main functions. The functions of the vertebral column are to protect, to support. It also forms as an axis, and it is for movement. Protection, it protects the spinal cord within the spinal canal. It supports the weight of the body above the pelvis, and for movement, it plays a role in both posture and in movement. So the vertebral column, as you can see, it can be divided. We have the cervical, which is 7, divided into 7 vertebrae. We have the thoracic, divided into 12. The lumbar, divided into 5. The sacrum, another 5, but they're fused. The coccyx, another 4, but they're also fused. So let's go into what is lower back pain. According to World Health Organization, better known as WHO, lower back pain describes pain between the lower edge of the ribs and the buttocks. Lower back pain can either be specific or non-specific. Specific lower back pain is pain that is caused by a certain disease or structural problem in the spine, or when the pain radiates from another part of the body. While non-specific lower back pain is when it isn't possible to identify a specific disease or structural reason to explain the pain. Lower back pain that is non-specific is in about 90% of the cases. Lower back pain can often be caused by a combination of factors, and even the best scans, for example, things like X-rays or MRIs, are often unable to identify a clear cause for chronic lower back pain. So let's talk about the prevalence of lower back pain. So lower back pain is the leading cause of disability worldwide, and 690 million people experienced lower back pain in 2020, and this is expected to rise going into 2050.
In continuing with our lower back pain, as mentioned in your L spine, which should be located at the bottom of the spine, basically, between L1 and L5, coming from the ribs down to your pelvis, you will experience different types of pain, be it sharp, dull, aching, or even a combination of these pains. This pain has been found to affect more females than males, but it can affect anyone in any age group. No matter how young you are or how old you are, if you've been involved in an accident or not, back pain can occur to anyone. And it has affected many persons' quality of life and their mental health and well-being. Back pain can affect you for different lengths of time as well. Sometimes it can go away by itself. It can be there for a short period, which is known as acute, subacute, or chronic, which is a very long time. And you can have different things that may cause your back pain, be it low levels of activity, smoking, obesity, physical stress, different types of cancer, tissue damage from an organ. We have different conditions, besides what will be spoken about tonight, that usually cause back pain that we know about. One being osteoarthritis, which is very common, and when it is found in the spine, it is known as spondylosis. And generally, it's found either in the neck or in the lower back. And most of the times, a lot of vertebrae may be involved, usually L4 to L5, and further 5 to S1. In this condition, you get a lot of stiffness, pain, weakness, and limited range of motion. You also have lumbar strains, something that we all happen to get by lifting something incorrectly, turning quickly, picking up something that's quite heavy. And that happens to tear or stretch your muscles and cause you a lot of pain. Sometimes it can happen gradually or it can happen suddenly. And that causes your tissues to be swollen and you get more pain and spasms. We also have disc diseases, which are also known as disc bulges or herniations, commonly occurring in L4, L5, L5S1 once again. And it usually occurs due to aging, where the structure of the discs, which form in between the vertebrae, they start to dry out, and you get less space in between your bones. And sometimes this can cause a compression on your nerves, and you get changes in sensation, numbness, weakness, and pain. You may ask, when should I get help for my back pain? You may have back pain, as I said, for a short period of time or a very long period of time. And if you've had your pain for 2 to 3 weeks and it does not seem like it's letting up, it's stopping you from doing what you usually do, you should get it checked out. Also, if you have it for more than 6 weeks and it's constant, it is really bothering you, you need to go to your doctor, let the doctor give you a scan or a check, and come to a physiotherapist.
So, when could my lower back pain be serious? When we might want to know, like, when do I know that this is serious, that I should get this dealt with? When you have bladder or bowel symptoms. So either you're having difficulty holding your urine, difficulty holding your bowel issues, you should see a doctor and refer to a physiotherapist. You also, if you have impaired sexual function, if you have a loss of sensation or power in your legs, so the legs feeling very weak, or you feeling numbness in your legs, those are also same reasons that you can say your lower back pain is serious. If you're also feeling unwell, so you have a fever, it feels really hot. If you're over 50 and you had a history of cancer or you aren't feeling well, and you have developed pain for no apparent reason. Also, for traumatic injury like a fall, or if you were involved in an accident.
Physiotherapists are movement specialists, and we will provide expert advice, guidance, and treatments as to how we can assist you with your lower back pain. But although we are assisting you, you play a pivotal role in the management of your back pain. Your self-care and your self-management is very important. You will be learning how to control your pain, how you must have confidence to trust your back again. We will help you with overcoming fear of movement and injury. You will remember or learn about the importance of sleep, how you are going to manage your stress and stressful situations. We're going to help you with becoming more active and how you will function in society.
Exercise is very crucial for managing lower back pain. Exercise is helpful and it helps you with moving with confidence and without fear. Exercise is helpful to prevent lower back pain from returning. Exercising regularly is essential. And sometimes you may feel sore after exercising, but this does not always mean damage to your body. The best type of exercise is one that you enjoy. Any type of exercise, whether aerobic, whether specific to your core, whether it is dancing, all of that is crucial and essential to helping you with managing your lower back pain.
We hope that we have been able to give you a snippet about lower back pain and that you understand, and it gives you a foundation for what you're going to hear tonight and what you will carry on with in life. Good night.
So should I start asking questions now or after to see who is listening? After? All right, someone over here says after. Someone over here folding her lips. Now or after? Okay. So, next up we have Miss Jasmine Eveling, and she is a pelvic health physiotherapist and a yoga teacher. She loves movement, and as a pelvic health physiotherapist, she works closely with women throughout their pregnancies to help them minimize back and pelvic pain, as well as prep for birth and postpartum. She is delighted to share with us tonight on pregnancy and back pain. We will not be seeing Miss Jasmine Eveling in person. We will be seeing her on the screen, and as a result, we will be having Dr. Jerry Warner come next to share with us, and I'll just let you know quickly about Dr. Jerry Warner. He's well known for his infectious laugh and his stern, practical advice to patients. Jerry Warner is the chief physiotherapist at the Queen Elizabeth Hospital. Jerry was raised in the quiet community of Pegwell Boggs, Christchurch. His formative years were spent at the Water Street Boys School and Harrison College. He later moved to Jamaica to pursue his studies in physiotherapy. He completed his doctoral studies at Utica College, upstate New York. He has completed a certificate in swimming from the International Swimming Federation and has served as a scout leader. He has a wealth of experience presenting on this topic. So ladies and gentlemen, Dr. Jerry Warner.
Hello, everyone. Good evening. Good evening. Let's stand, please. No prayer. Just change your position because we can't sit all the time. Wonderful. And sit again. Thank you. The technology is giving us a lot of trouble, so I hope it works for me. Please sit. Thank you. Are we okay to go over the slides? If not, I'll just start to talk. Okay. Right. I'll start to talk. Somebody please time me. It can go on too long. Lifting and handling. So, yeah, that's cool. I'll talk. That's okay. So, unfortunately, we wouldn't have the visual to accompany me, but that's all right. When we lift, the muscles that we talked about just now, the lower back muscles, they move through. There's a force that occurs at the front. I'm going to step away briefly. This is our center of gravity right here. Those who do ballet, make her dance. So you will see the guys balancing right about here. Okay? When we lift, this way or that way. There's a force moving through the back based upon that center of gravity. Your lower back is very close to that. So if you bend over, the muscles in the back, there's a force that's going to go through them that is as much as 4 times your body weight. So let's say you are nice and trim and slim and you're only 100 pounds. You bend over, that's 400 pounds going through the joints and the disc of the lower back. If you're not so trim like I am, there's a lot more force going through the joints of the lower back. Anyone has had lower back pain knows this. When they try to get it from sitting, that's just the reverse of bending over. It's painful. When they try to bend over, it's even more painful. Oh, here we go. So now we're back into business. Oh, no, I don't think that's going to be good for everybody, right? So when I talk tonight, I want to give you an idea of what's happening at your back. And after we finish this conversation together, you should be able to understand what happens and have an idea of how to prevent it as you lift. Now, you notice I've said lifting with or without back pain. In other words, whether you have back pain or don't, the correct things to do for the biomechanical safely. Biomechanics, living mechanics, the movement of your spine and muscles to protect your joints, muscles, ligaments, and nerves. I don't think the presentation with the anatomy dealt a lot with the nerves, but we would have mentioned then, I'll just talk about this briefly, the pain running down the back of your leg, pins and needles, numbness, as Bajans say, ning-nings, those are nerve sensations. There's a completely different now to the soreness, sharp pain, dull pain that you may get from a muscular concern. Nerve pain is very difficult to manage and very difficult for people to understand. So you want to understand there are two different types of pain that you may get. Muscular pain that you will treat with movement and anti-inflammatories, whether it's a natural anti-inflammatory like ice or heat, and then the nerve pain, which is slightly different, that will require release of pressure on that nerve, either through particular stretches that we would do, traction, and positioning that would stop us from putting excess force, like I just mentioned, through the lower back. We're going to bypass this because the others dealt with this pretty quickly, and we're going to go on to our next slide, please. And we're going to pause here for a short video, if it plays. I know we're getting some difficulty with the playing. And what this video will show is the way to approach a lift. Go ahead.
Looks and sounds simple enough, and it is once you've got used to it. Let's run through it one more time to make sure. Test the weight. Stand facing the object with your feet shoulder width apart in a 10-to-2 position, one foot slightly in front of the other. Keep the object squarely in front of you, no twisting. Lower yourself by bending at the knees. Remember, don't stoop, don't bend at the waist. Keep a naturally straight back. Grip the object in opposite corners with the palms of your hands. Keep the object as close to your body as possible, straighten knees and lift smoothly. Move slowly and steadily, keep looking ahead. With your feet in the 10-to-2 position, bend at the knees to lower the object. Finally, adjust the load later.
Thank you. So, what you saw was his attempt to stop the back from bending over at that point that I showed you, to keep the back as straight as possible, to minimize the forces through the lower back, which, as I said to you before, could be as much as 4 times your body weight. That is not easy to do if you don't make it a habit. The natural thing for us to do is this. It's very, very natural, but very, very wrong. So for those who have to lift, and we all lift on a daily basis, even if it's just putting on the shoes that we have to buckle up or lace or push our feet in. If we drop a pen, those are the light weights. It's not too bad. If we go to the supermarket, we're going to pack our things into the groceries. We're going to come to the kitchen a little bit later. We'll talk a bit about that. So many things in our life involve lifting. So it's important to adapt the pointers of that video. Our next slide. We'll bypass that one. I think that's going to cause
Manual handling is the movement of loads. It can be carried out by hand or by bodily force.
We can slip. We can skip, because I know Melissa's actually going to cover that as well. So, all right, we'll continue. So, once we have looked at what we need to lift with, let's talk a little bit about the muscles that are involved. We're looking a lot more at the muscles of your legs being used as against the muscles of your lower back. And I do have now, for those who will say to me, but I got some bad knees, they creak a little bit, I can't bend like I used to, I can't stoop as I used to, I can't squat at all. So we want to give you some pointers too on how to do that in a modified way to prep your muscles for the ability to keep your back as straight as possible. And I think that should be our next slide. If it please. So it's not playing. Right. In anything that you do, you have to prepare yourself for it. If you're going to be protecting our back as we lift, we have to strengthen both the muscles of the core, but also your muscles of your leg. And we'll come to the assistance later. That can stay there as I talk. When Trudy talked about exercise, she talked about general exercises. She mentioned doing things that you like to do, and that's important. So let's say you like to do gardening, but gardening involves naturally a lot of stooping or a lot of bending over. So we would recommend to you to sit on a stool, a drink crate, if you all know what drink crates are, though the younger people probably don't know what drink crates are. But the older people like me know what drink crates are. They probably still have a few of them. A block, something that allows you to sit and then work at a lower level without having to bend as much, or cut can gardening. And those cans, they're available at fairly reasonable rates, and you can bring it to a higher height than bend, so you don't have to bend over at all, and again, you can use the gardening tools. For those who can afford to go to the new hydrophonic type setup, where you use PVC pipe, holes in it, and then you have a drip system, and that is a lot easier as well because you can actually operate between neck, shoulder region, waist, head region without having to bend over at all. When it comes to lifting as well, the other way that we can minimize the force in our back is to use help. So help can come in many ways. Help can come with another person helping us to lift if the weight is too much, and help can come by using assisted devices in lifting. What was on the screen before it started to give trouble again was a simple furniture lifting strap. I hardly see these in Barbados, and they're very, very, very useful. So if you look at it, it's an X pattern that goes across your torso. The base of it then goes under the furniture. If you look at the bottom picture, under the furniture that you're going to lift, back is upright, two people stand up, and the force will come with you. I've seen these in use lifting fridges, lifting couches, etc., rather than what we're still doing now, which is bending over and lifting them up. These I've seen available on Amazon for about $20, $25 US. They're nylon made and based, and they're actually quite strong. This is something that I strongly recommend anyone who has a job in lifting to either talk to their boss about or invest in. Even for those of us who clean and like to know we're moving the furniture around every Saturday so you can get behind the couch and under this crevice and so on. This is something that would go a long way in minimizing the forces through your lower back. Okay, now I want to talk a little bit and get into your personal life a bit about the things you do at home. We're sitting in some chairs now, and they're not the worst chairs, but they're not necessarily the best either. Most chairs are designed with a space that offers no support for the lower back where you need it. Now, I'm not going too deep into your area, Melissa. You're dealing with the workplace. I'm dealing with your house. At home, almost all of your chairs are designed to cause you pain. Your sofas are designed for giants. The legs are so long that when you're on them, they either putting pressure in the back of your knee. The back is soft and doesn't have any real support for your spine. Some people are nodding. The cushions are nice and fluffy and oversized, but again, I'm not sure what they're designed to fit. And if you are from a household that has a grandmother in it, don't dare use a throw cushion to put it in your lower back because you're going to be in trouble. I see people are nodding again. And it wasn't a grandmother, it was my mother. And those cushions were for decoration only. Now, throw cushions aren't bad. Besides that, their design actually would fit pretty good into the lower back, and you want to give some support to your spine when sitting. So imagine this. You've come from work, you've gone home, you want to rest a bit. The chair you're sitting in the car can cause problems if it's not well adjusted. The chair you're sitting in at home can cause problems if it's not properly adjusted. I had slides to show you all these things, but we'll just talk it through. And then I also mentioned I was going to go into your kitchen. So most kitchen cupboards, you've got the below part of the cupboard, the counter, and then your upper part of the cupboard. And guess what we do? We put the heavy stuff down in the bottom, which means that we're forcing ourselves to bend over. And you're telling me, oh, I don't do any lifting. Yes, you do. And we have wholesale places in Barbados now. So you're going to get large bags of rice, or you can get large bags of rice. I'm not calling anybody store, so I'm not doing free advertising. Large bags of rice, large bags of bottles of cooking oil. You can get large bottles of water. These are the things that you can have, and then you want to get access to these things, you're bending over. Or you've got your special favorite stainless steel or copper saucepan at the top that you want to make your soup with on a Wednesday, and you're going to reach up to bring it down. Again, unnecessary forces. We do these things all the time. We don't think about them. So we keep adding these micro tears that Trudy was talking about to the muscles that are already complaining, already overworked. And we don't understand why after I finish cook, my back hurting me, my shoulders hurting me, neck hurting. Yeah, so think about the actions that you do. I'm going to come to your bed too. Think about the actions that you do and the ways we can minimize them. So I've talked about your kitchen. I have talked about your car. I don't know if you can, I've talked about your couch. I've talked about your car too. And I'm going to now talk about your bed. No, not going too much into your area. Again, keeping it simple. Our muscles in our back never stop working. The postural muscles, they're always engaged. They're always working. That's the first thing we got to remember as well. They don't get to rest, really. So even when you're lying down, especially if you are of the Negro race, which has some particular physical attributes which are quite pleasant for the males to look at, but not always painless in their result. So you got a deep lumbar curve. We call it the lumbar lordosis. And you would hear people in the textbooks tell you about flattening the lumbar lordosis. Impossible in a black female. Impossible. All right? We can perhaps minimize a little bit of it. So we can put a pillow under your knees if you're lying on your back. If you've got a lot of hips, you can put a pillow between the knees to try to maintain a level pelvis. For the neck now, again, the cervical pillow is one option, but for persons like me now, I can't use a high pillow anymore. High pillows don't cause me neck pain. So over time, I've had to keep my neck more in neutral and into perhaps a little bit of extension rather than flexion. They change with time because I'm not getting as young as I used to be. And these are things that you will work out for yourself. It took me a little while to work that out, even though I'm a physio. I started waking up with pins and needles down my hand. I was like, what's going on here? And then I was like, okay, let's do some exercises on our neck. Let's check your range of motion. And then all I needed to do then was to change from a high pillow to a flatter pillow. And bam, it was gone. And simple things like that are what we need to be aware of in our posture. Bed surface, last thing, Andrea. Last thing. Firm bed surface. Not soft. Foam mattresses are cheap. Leave them in the store. If you want to know how long a foam mattress is going to last you, think of the sponge that you use to wash your wares with. And tell me how long it stays at the height that you bought it at before it really becomes compressed. Leave them in the store. Save a little bit more and get a mattress that has springs within it, your pillow top or otherwise. And I'll tell you a little secret that Andrew may or may not have researched. Memory foam is not good for your sex life. I'll say it again. Memory foam is not good for your sex life because it absorbs force. It doesn't allow for rebound. And I'll stop on that topic. The rest is at Andrea. Next slide, please. Right. I did mention that I was going to go into your car. Just very briefly, you want about 90 degrees at your elbow. Head neutral, not forward, not rocking back. You know, two wheels, two hands barely touching the steering wheel. And if your seat height can be adjusted and your seat has a lumbar roll, you also want to put that in place, tighten it up so you get good support there as well. We're coming to the end of our talk because I know the slides are now, because I was talking ahead of what was going on, we're going to be all over the place in slides, and I know my colleague is not very pleased with me because I'm using the word next slide, please, and she doesn't like that, but I love her, so that's okay. And we talked about the fact that we have to exercise, and I was going to show you some modifications on the exercise. We're not going to go into that now. I'm actually going to wrap up shortly. So let's talk briefly again. Curves in your back, you talked about the lumbar region, inside inward curve, thoracic region, outward curve, cervical region, inward curve, lordosis, kyphosis, lordosis again. Not straight. So any force acting through that will create increase pressure on the muscles which are always working to keep us upright. I told you that they're always working is because we are not bent over, we're not on all fours, we've evolved and we're upright. So they're always working to keep us upright. When we move, we put a lot more than just our body weight through particular areas, especially lower back. We want, therefore, to try to maintain as erect a trunk as possible when doing our movements. That's a brief summary of lifting and handling. Try to keep it as simple as possible, and I am willing to take any questions at the time that is necessary for me to take them. Thank you for listening to me. Have a good evening.
Thank you, Dr. Warner. I promised you earlier that I would ask you some questions. So I'm going to go back to the first set of presenters and ask you, what are the sections of the spine? No physios or retired physios are allowed to answer, or physiotherapy assistants. Yes, sir. One more. Well, two more. Sacral and
lumbar, thoracic, cervical, and sacrum.
one.
Coccyx wrong.
There you
That's
go.
the last one, right.
Give him a round of applause. All right. Next question. Give me 2 muscles that you can find in your back. Just 2. See, y'all ain't listening. Trapeze. All right, good. Give her a round of applause. She said the trapezius and the rhomboids. All right. So next question. What type of bed are we all going to slumber P-Dick and buy in tomorrow? Right. And where are we going to put our heavy saucepans? Or heavy shopping, rather, heavy groceries. At the top? Okay. All right. I hearing a lot of mumbling, but I hear the right answer.
Arm's length.
Okay, there you go. All right. So, you all win. All of you that answered, you win. A big round of applause from everybody. Woo! There you go. Wonderful. So, answer another question and you might win something else later. If you do have any questions for Dr. Warner, you can feel free to see him after. He will make himself available. Or if there are any pressing questions right now, I'll give you 2 seconds. Any hands? No hands. All right. So next we have Dr. Melissa Pusey. She is the owner of Total Therapy, Inc., a multidisciplinary rehabilitation clinic in Maxwell, Christchurch. In 2002, she participated in her first ergonomic course and found a passion. She has since been doing office and industrial ergonomic assessments in a number of businesses throughout Barbados. Ladies and gentlemen, Dr. Melissa.
Good night, everyone. Hey. All right. So tonight we're going to be talking about ergonomics and how it affects our backs. Okay. So this is a typical slide of what most people ask what ergonomics is about. This dad is bending down. Clearly, he's doing everything Jerry told him not to do. And he's telling his son, ergonomics is making children tall enough that dads don't have to bend so much. All right? So that just gives us a general idea of what ergonomics is. However, if we're going to be really on point about it, The United States Department of Labor defines ergonomics as the science of fitting workplace conditions and job demands to the capabilities of the working population. In other words, we're trying to make your environment as comfortable for you and prevent as many injuries as we can, right? Right? So what are the benefits of having an ergonomic assessment? Well, once you're comfortable in your workplace, you're going to increase productivity, and of course, you know, it's going to reduce the risk of you getting injured, having any repetitive stress injuries, or having any illnesses within the workplace. So in other words, you're going to be a happier worker, and of course, everyone wants to be happy in their workplace. All right? So where is it applicable? We're looking at any office. We're looking at tall desks, regular desks. We're looking at factories, we're looking at warehouses, and we're looking at service industries. All right, so let's talk a little bit about the office. When you think of the office, the two things you think about are the desk and the chair, right? So most desks come at a standard height. What we're looking at is that you should be able to have at least 2 inches between the top of your leg when you're sitting and the desk. If you're not having that, then we need to speak to somebody about it. Most of the companies here do adjust desk, and there are always very simple solutions. When we're looking at the chair, you need to make sure that when you're buying a chair, you have, you see that, notice the back of that chair is curved a bit, because you want to be able to have some level of lumbar support. And we also need to make sure that the back of the chair goes up and down, because everybody's back is, the lumbar curve in everybody's back is not going to be at the same place. So we want to ensure that your back can be fitted to that space. You want to make sure that the height of the chair goes up and down. You want to make sure that, that you also have armrests that can go up and down. Right. The next question I always get asked is, where is the appropriate position for the monitor, right? I follow that up with the question is, do you wear glasses, and do you have bifocals in your glasses as well? Because that significantly changes the angle at which you're going to be looking at the monitor. So your monitors need to be at arm's length away from you. So everybody's arms are different. So the length is going to be individual to you, right? You want to make sure if you are wearing regular glasses and you have no issues at all, that your eyes are literally at the midline of the computer. So you should be seeing the mid, and so your eyes can go up and down, and you can read the document without having to have a lot of movement. So what we're aiming to do is try and reduce the amount of movement that you're putting, and the amount of pressure you're putting on your shoulders and your neck and your back. All right? So ideally, the first picture is the one that we're aiming for. If you have bifocals, sometimes we have to fiddle a little bit more with the monitors, because depending on where they're positioned in your glasses, you may want to lean your head back. So it takes a little bit more fiddling, but it can accomplish the same thing. All right. Now, in nowadays world, everybody has multiple monitors. Long gone are the days when you have a single monitor. So we're looking to minimize the amount of twisting and rotation in your back. In a situation like this, we want to make sure that, one, all the monitors are at the same height, including the laptop. We want to make sure that your desk doesn't have any cords or anything to trip you, and that you're in the most comfortable space. All right. There are a number of setups. If you're having a single monitor, you do want it directly in front of you. If you're having a primary and a secondary monitor, so a secondary monitor is like a monitor that you would only be using to do Zoom calls on, or like if you were using that monitor to open doors for some, in the building that you were working. And when you have 2 monitors that are 2 active monitors, you really want them more at a V angle. Ideally, you should be able to sit down and look from one side to the other without having to twist your body, right? Because what we're looking to do is reduce the amount of movement in our spine. Now let's talk about adjusting our chairs. I'm often amazed at how many people do not do any adjustments on their chairs at all. They come in and they just sit, and then they wonder why their backs are hurting them. So as you can see, the green spine there is positioned comfortably along the ridges of the back of the chair. All right? He is sitting with his elbows at 90 degrees, His wrist is at neutral, the hips are at 90 degrees, the thighs are fully supported, all right? His knees are at 90 and his feet are flat on the ground. This is the sort of position that we're looking at for you to maintain for the majority of the day, all right? Yes, sometimes you'll see people easing forward on the chair and back. Yes, you get a little uncomfortable and you need to move, but your chair should fit you so that you're the most comfortable in it during the day. Right? Sitting is now considered the new smoking. So what we're encouraging people to do is get up and move. When you sit for prolonged periods, you're reducing the oxygen flow in your lungs. You're not taking any deep breaths. Your circulation is getting slower. Your cardiovascular system is not working at its optimal. So we want you to get up. We want you to move. So there are a number of options that are now available on the market. We have the sit-to-stand desk. The good thing about these is that these can be used in multiple spaces. So if you have a shared area, because the desk heights can go up and down, you literally, when you're at the desk and in your stand position, you want to have your shoulders relaxed, your elbows at 90 degrees, your feet flat on the ground, all right? Same as if you were sitting in a chair, just upright, right? And then you can go between. And the next thing is you need to get up from your desk. Everybody talks about stretching at their desk, stretching at their desk. What we want you to do is get up from that space, take a couple deep breaths, move your wrists, your shoulders, anything that needs, feeling a little tight, and probably take a little walk around the building as well. We need to get you moving. All of that sitting in the day is not good for you. And the more you sit, the more pressure you're putting on your back. You need to relieve those muscles, get them stretched, get them moving. Now, these chairs I've often seen, you may recognize them. These are the chairs that you will see like at the supermarkets or like if you go into the bank, these are the ones that the tellers will use. A lot of times, you see there's a silver ring at the bottom of the chair. That is supposed to be used when they're sitting to put their feet on so that your feet are not dangling during the day. Very often people don't adjust them at all or they just don't use them, and they feel as though they're dangling in the chair. The problem with that is that you're putting excessive pressure on your lower back by just having your feet dangling like that throughout the day, right? All right. Now let's talk about some industrial ergonomics. All right. We go into factories, we go into different places, and we look at the work settings that people are working in. Very often, the factories are at a specific height and cannot be adjusted. So if you have someone in there who's short like myself and the factory is tall, they're going to have difficulties because they're putting a lot of pressure on their back while they're leaning back to accomplish their goals. We'll come in and we'll look at what is the task that they're required to do, and determine how can we make this easier for them. Sometimes it might be something as simple as putting a stool in the area. Sometimes it might be something a bit more complex where we have to train them in another area where they will not be using as much, will not be forced to put as much force on their backs while doing that. We look at things like what sort of equipment are you wearing? And usually these assessments are done along with the health and safety officers because we're trying to ensure that whatever issues they have, we can address and make the working environment as safe as possible, right? We're looking at things like water on the floor because that's a trip hazard. You don't want anybody to fall within the workplace. We're looking at things like shoes. We're looking at, are you wearing the appropriate gear for where you're working? If you're working in a freezer, do you have freezer gloves that can do with the temperature that you're dealing with? Or are you just wearing, a regular set of gloves? Are you keeping your back warm when you're doing these things, right? We're looking at things like the safety of people within the workspace. So you're making sure that there are things like pedestrian walkways so that the people who are using the heavy equipment within the areas are not going to be hitting into people unintentionally because they're not seeing them, right? We're making sure we're reducing the risk of accidents, right? We're also going into the equipment that you're using to lift, as Jerry alluded to. We're talking about things like pallet jacks. We're making sure people are trained properly in using them, simply because everybody thinks they know how to use a pallet jack until they don't. We make sure, we will go in and test to make sure that things are working properly. which should be done which we tend to try to do once a year. The health and safety officers usually will try to do it on a more regular basis, but sometimes when you go in, you spot things that they don't necessarily see. We're talking about things like trolleys to carry the heavy goods, so you're not lifting things or going from different, going distances carrying heavy loads. We're looking at things like step ladders, because you have to climb up distances to get things. You shouldn't be reaching at a certain height. You should be able to use the appropriate equipment to make sure that you're getting what you need to get from where you need to get them. All right? And lastly, I'm going to discuss the service industry. I'm sure you've seen these cashiers set up like this, where you have one, like they're two together, and the place that they're checking out is on the side of them. Anybody has an idea why you'd want to do it this way? Any thoughts? Yeah. Okay. So if you are working the right cashier every day, you're always using your right side, you're turning to your right side 24 all day, every 8 hours that you're working, you're turning towards your right. That can lead to repetitive strain. Just the same as if you were on the keyboard, just the same as if you were doing something else, right? So what we're aiming to do is to try breaking down that repetitive movements. So we put one on the right and one on the left, so that you can spend one day working on the right and then the next day working on the left. I have found that once we institute this, we have a lot less back pain, a lot less issues with the wrist. I've also found that once the employees understand the reason behind it, then they will make sure that they are working different sides every day. So you really have to get buy-in. You know, taking care of our backs it's about us as well. Yes, physios will give you things to do and we'll help you out along the way, but you have to take ownership of it. All right? Thank you very much.
I'm going to get straight into the introduction. Miss Andrea Quintine. She has practiced physiotherapy for the past 42 years, and she is the owner of a private practice in Barbados. She treats a variety of presenting conditions with a focus on musculoskeletal injuries and the use of manual techniques. She has a diploma in physiotherapy with honors from UWI, Jamaica, and she is an ACSM health fitness instructor. She is a NASAM corrective exercise specialist and OSHA accredited biomechanical analyst. She has a special interest in evaluating and treating and the treatment of temporomandibular joint dysfunction and the use of Bad-Raj aquatic therapy for decompression of spinal stenotic conditions. Ladies and gentlemen, to present to us on a very taboo topic, Miss Andrea Quintine.
Good evening. I would like to encourage all of you to stand for a few minutes, maybe just walk around. Again, just getting it in motion, keeping it real. And while you're doing this, I'd just like to lay a disclaimer. If anything awkward comes out of my mouth this evening, it has nothing to do with me. It's those young techie colleagues and their AI, okay? Good. Once you're nice and stretched, feel free to put your arms up. Then you can be seated. It's very important, as we keep hearing each of my colleagues saying, it's so important that we move. keep moving. The need for love and intimacy is a fundamental human need. It's as primal as the need for food, water, and air. And this is a quote that I took from a physician who is a fellow in preventative medicine in California. And this really sets the temperature for the presentation that I'm going to bring to you this evening. It's very important for us who have been suffering with chronic pain and other illnesses that alter our everyday activities. It is very important that we seek to restore comfortable sex that's lost to back pain. And why is this? All of us, from one degree to the other, have a certain amount of sexuality. Sexual intercourse is integral to the adult, integral to the normal, natural functioning of your daily life. Research papers extol the mental, physical, and emotional positives for healthy sexual activity. What are some of the health benefits that you can go and Google later that sexual activity has been researched and has been confirmed as providing? Lower blood pressure, a better immune system, better heart health, improved self-esteem, decreased depression and anxiety, increased libido, immediate natural pain relief, because yes, as we approach the point of orgasm, you literally will release endorphins, which are our body's natural pain relievers. And of course, at the end of it all, a better rest. You're more relaxed, you have a better sleep. Knowing all of this, we need now to look at the safety checklist of positions. It is very important for us to understand what are the positions that feel better for backs when we're in pain, and what are the positions that actually can cause irritation. And during my talk, I will refer to flexion pain, which is the pain of bending forward. Extension pain, the pain that you get if you bend back. And movement pain. And this is the pain that you just get with just moving, like when you're in a vehicle, a bus, a car, etc. So you really can throw the categories into three simple: flexion, extension, and movement. So if bending the spine forward, flexion pain is increased, a flexion pain sufferer, then you want to look at the positions that place the back in an arched, that's the opposite, in an arched position. That would actually be better during sexual intercourse and may relieve some of your pain. The positions which have less flexion or more extension will help your condition and permit comfortable sexual intercourse. So this checklist really is for us to have a look at what really is it that I need to avoid, what is it that feels better. Then you are able to translate those positions from the vertical setting into a horizontal view. Are you all with me? All right. If you have significant pain with motion, then you want to be able, yes, Trudy. Okay. All right. Trudy's just reminded me when I move, no one's hearing. So I will have to repeat it. Sorry about that. I think you can see from my positioning, though. If you have significant pain with the motion, then you know that you automatically will have to be the passive partner. And this is where your partner would be the one to do most of the activity. Here we go. Can we just, it's my error, sorry. I wanted to just touch on at the last part, very important, the use of support. You can use pillows, cushions, even you can go as far as wood, which also then can have like your muffin top on top of it. And this is to say to my colleague, yes, I did research it. And indeed, what Jerry said is quite true, because the force, you want to be able to have a surface that supports your back and absorbs any forces, help to reduce the impact of the excessive motion that can then throw you into either an extended position that may not be good for you or that flexed position. Before I start, you may hear me and you may see on the slides certain wording. The receiving partner, the giving partner. So the receiving partner is the partner that receives. The giving partner is the insertive partner. And there's probably at times you're going to see next to the receiving partner or giving partner the little word PN, and that's when I'm referring to the partner that is suffering the pain, the discomfort. So we're going right into it, and one of the positions that is perfectly safe, acknowledged as one that can be easily manipulated is missionary position. This position is excellent not only for people suffering with discal lesions, as you would have heard Trudy and Julissa speak of, but also for the older person who may be suffering from degenerative diseases, spondylitic changes. The missionary position allows for the modifications. Yeah. So I'm going to walk over and ask for the missionary position diagrammatically. So here you see underneath in this one is the receiving partner. If the receiving partner is the pain partner, it is quite easy to have stabilization by placing to encourage the lordotic curve, the natural curve, to have pillows put underneath the receiving partner. If in fact they are suffering from flexion pain, they may actually be happier having a small cushion or pillow under their upper back, which takes the spine into that flexion, more relaxed position for their type of pain. The given partner, if the given partner is on top and is the pain partner, there is some adjustment that will be required by the receiving partner underneath. Because again, if the given partner, which is the pain partner, is on top, it is very likely that the thrusting is going to create flexion pain if there are a flexion pain sufferer. And therefore, the receiving partner can modify the position to reduce the necessity for the thrusting, can actually lift the body slightly higher, allowing the given partner to kneel rather than lie flat, and therefore the thrust can be achieved through the action at the knee. So there are, it really is for partners to be open to experimenting, to seeing what works, to seeing what feels best, what felt good. Let's try that again, for sure. If we flip it and we have the given partner underneath, again, the support would be required for the given partner, either using the board with a muffin top cover on it or a thin pillow, adjusting the position so that you're not putting yourself into excessive flexion, or be it the extension. So you can flip it, but it requires, again, that you check, you adjust, and then try again. We can go on now to the second position. This is what I've just discussed and explained on the screen. So the doggy style position. I'm going to make a statement here. You can take it as you like. This is my favorite position when I am speaking to my patients who are asking for advice. This position allows the receiving part. This position, I know you thought I was going to stop. I knew I would get one. This position allows the receiving partner to control their spine, control the spinal movement, control the amount of lordosis, the amount of flexion, because they're able to support through the shoulders and through the knees. If in fact the given partner is the pain partner, again, making sure that they recognize if you're a flexion pain, you're going to do the thrusting through your knees. And certainly if you are an extension pain, then you're definitely going to hold yourself in that erect position with your core engaged, which goes back to my colleague, Jerry, and Melissa. So do you see that, you know, this back pain thing is all a huge part of our lives, very huge part. Moving on, we also can look at the sitting or straddle position. Now, this position is a little more adventurous, and I strongly recommend that if you are a flexion pain sufferer, this is one of the positions that you may not be as comfortable in if you are the partner that is on top. Because you can see the action is actually going to bring you into, through the pelvis, into a flexion position. What is really nice about this position, the straddle or sitting, is that you can, the partner on top can actually be the one that is the active partner. The partner underneath can be the passive partner in this case. And it doesn't only have to be sitting with the partner underneath lying, but you can actually use the chair, again, with support, but the partner that is on top would need to be able to rest their feet on the floor so that they're stable. Are you all understanding? Yep, for sure. There was one other thing that I wish to mention here. And in the case where the pain partner is the given partner underneath, the receiving partner has to be careful with the amount of force and movement. And this is again where the shock absorption comes in with adequate support under the back. The partner, as a receiving partner on top, can also do the full squat position, which is also extremely therapeutic for some backs. Face down position. This position is not, again, advisable if the given partner is the pain partner, because really and truly it is a flexion required with the pelvic thrust. Unless he has an extremely artful receiving partner who can twerk, then it's okay. Spooning. This is very often the position that my patients would say to me, the doc has recommended this, but I'm in worse pain. Again, if everyone is now following where you translate what hurts you when you are standing to what would hurt you when you are lying, while side lying is excellent when you're inactive and properly supported with your cushions because it decompresses the spine, if you are side lying with some form of activity, you're going to create either flexion, excessive flexion at some point, or extension, if you look at how these two are lying. So the receiving partner would, getting into the activity, would necessarily, if they are an extension pain person, would have some difficulty because it would require an extension of the back. Similarly, the giving partner, if they are a flexion pain person, would have some difficulty in pleasuring their receiving partner because they would be required to do the flexion activity. So spooning is not necessarily the first and foremost answer for the chronic back pain sufferers. That is why I said that I really like the doggy style one because it lends itself to a bit more flexibility with how you position. But all of that said, it is very important that you try. You try things, experiment, see how it goes. It's important for us to be open enough, to be comfortable enough that we can speak to one another about what your fears are, your inhibitions, apart from the pain. This side of the world, just having open discussion about sexual intercourse is taboo. It's something that really you shouldn't be doing it. So it's really important that you become comfortable enough and say, look, this is what I feel, this is what I would prefer. Would you like to try? So you want to have open discussions that will reduce the limitations, that will bring you away from the social taboos and your emotional fears. Because obviously, if you start to think, I'm not able to fulfill my partner, this is going to be the beginning of some other dramas playing out in your head. It is important for the non-pain partner to have understanding, to be patient and supportive of their partner. Pain is real, and until you suffer it, you really don't understand. And it can so often block the excitement of a night well prepared for and anticipated. So partners of pain sufferers, you really do need to be understanding and empathetic. And of course, on both sides, the willingness to accommodate. And this is not just with the actual sexual activity, but the accommodating coming from where you start to prepare yourself, look for the alternatives, and be mindful. It's important that you rest. Rest improves your physical state of relaxation and emotional calm, and it serves to heighten sensuality. The reduction of physical and mental stress releases the tension of your muscles, including those of your back. Great. Including those of your back, which therefore decreases the potential for pain. If you relax the muscles in the back, you reduce that compressive force. Planning, and so it's difficult to be as spontaneous as you perhaps once were with your sexual activity, your dates. You need to plan a little bit more. Importantly, preparing with some stretching and breathing, some of the simple exercises that we would give you to warm your back up before you actually get into the action of sexual intercourse is useful. One of the big pluses is to avoid notes is to avoid sexual intercourse first thing in the morning, especially if your pain is as a result of a discal lesion. During the course of the night, the disc actually, because it's not being compressed from gravity of movement, it literally will expand. And so, as you know, the disc is bulging out of line. Having expanded, it is going to be a fiercely more painful and a lot stiffer first thing in the morning. Going on that, you want to time then, if your plan is that you're going to have a lovely romantic evening, you want to take your medication so that it has kicked in by the time yourself and your partner are becoming a little bit more close into closing towards the sexual activity. A lot of my patients I have counseled in foreplay. You can incorporate this. Warm showers. What would a warm shower do? It improves your blood flow, reduces your muscle tension, so therefore it sets the stage for a more comfortable back during the sexual activity. Partner's massage. You're the one that will benefit as a pain partner, but you know there is no harm in that spooning position, nice and quiet, that you're also doing some of that massage so that you can incorporate and improve your overall communication skills, your body communication skills during this period where you're dealing with your back pain. It's really important that we are all open to exploring new ways of pleasure with one another, bearing in mind that sexuality goes way past the act of penetration and culminating in orgasm. Finding your partner's erogenous zones, and that would come in with the foreplay, the shower, the warm shower, the lovely warm oil massage. Doesn't necessarily mean that tonight I'm ending up where I'm receiving or I'm giving, but we're just going to enjoy each other. And even that will allow for the release of endorphins, which helps with that feel good. Those are the feel good yummies that our body can release. I want to encourage all of you to find the book Kama Sutra, which in Sanskrit means the book of love and threads of pleasure. Kama Sutra does not get straight into receive, give and receive. There is a lot of amazing stuff that can happen. Finally, there is a quote that I want to leave with you. Real intimacy is only possible to the degree that we can be honest about what we are doing and feeling. Thank you. And if there are any questions, I'm open. All of us are now open.
All right, so, should I? No, I won't. Andrea was confused just now that that was her presentation, and she couldn't get the mic back into the mic stand. Oh dear. Sorry, I shouldn't have said that. The children came back inside. All right, so we have a few questions again. True or false questions this time. From our last presentation, we have learned that it's better to do it in the morning. Is that true or false? False. All right. Then, pardon? Do what? Children are back. Relieve lower back pain. Ah, there you go. Next question. When we are purchasing a chair for our office, Is it better to have, it's better to have a chair that does not have a curve in the back? False. Melissa, why did you have to think about that answer just now? All right. Okay, so, all right, so we are going to move on now. And I was going to get you to stand up and stretch again because September is Movement Month. And as we are movement specialists, we should be doing that. So remember in primary school, we used to do this thing where we had to stand and put our hands up. So let's do it. Let's all do it. For those that don't know or haven't been to primary school in Barbados, come on. How y'all hands get? I want to put my hands in the air yet. You need to follow your teacher's instruction. Good. So hands up and out on your shoulders. You gotta do it fast. You can't do it slow. Hands up, forward, out, shoulders to the back, shoulders up, shoulders out, shoulders and down. And now for my lady here in the front that did not do it at all. You ain't do it. Why you ain't do it? Your shoulders hurting you? You ain't here with bare physios. Or we can deal with you at the end. All right, so you may be seated, guys. So usually after, well, if there's no, I try to choose my words carefully because as I said, the kids are back. So sometimes after the fireworks, we would have some form of fertilization, that's the word. Sometimes, yes? There's fertilization of the embryo and blah, 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 and all of that. And our next topic is pregnancy. And before we watch our video, this one is going to be a video presentation. Before we watch that one, I was stopped by someone as I was going back down the aisle, and they said, I'm introducing everyone. And I stood here and I did not introduce myself. So I do apologize. My name is Dwayne Hood. I'm a physiotherapist, and I am a part of the team as well at the Queen Elizabeth Hospital. All right? Yeah, whoop, whoop. You. All right. So sit back, relax, and enjoy the next presentation.
Hello, everyone. I am Jasmine Evelyn. I'm a pelvic health physiotherapist and a member of the Barbados Physical Therapy Association. Happy Physio Week, and thank you so much for coming out to our talk on back pain. Today, I'm going to be sharing a bit with you about pregnancy and back pain. I'm just going to pull up my presentation. Right, so it's just going to be a whistle-stop tour, really. As I said, I'm a pelvic health physiotherapist, so a lot of the patients that I do see are pregnant, and we learned that a really common complaint during pregnancy is back pain, okay? So the aim of this chat is basically for you to understand back pain in pregnancy, identify some of the causes of back pain in pregnancy, and then see how we can prevent it or manage it. Now, this information is for everyone. We all will know somebody at some point who is pregnant. And so you are now an advocate for back pain in pregnancy. You're going to be able to give them little tips, little tricks, and point them in the right direction so that they can live their best quality of life, all right? So back pain in pregnancy. Now, it usually occurs in the lower back region or the sacroiliac joint region. This is a really good time for one of my colleagues to maybe just stand up and give you a little idea of where that is. Almost 50% of women will experience back pain from as early as their first trimester. And the first trimester is like the first 12 weeks of pregnancy. And usually in that time, there are not a lot of huge physical changes that we can see with our eyes, but there are hormonal changes that are going to be contributing to the back pain, which we will get into shortly. And then when they experience this pain, a lot of it will continue into their first year postpartum, and postpartum is after they've had their baby. Now, if you think of that, a lot of times in the first year postpartum, some people are getting pregnant again, right? It goes on to say that 20% of women, that pain continues for 3 years postpartum. And we know that a lot of people are pregnant again in their first 3 years after having their first child. And so when we have back pain, during pregnancy, we can see here next statistic, they're saying that 85% of women will experience that back pain in subsequent pregnancies. So this back pain is going to take you into the next pregnancy, and you're probably not over the back pain from the first one, right? So this is why back pain should be considered something that we take seriously during pregnancy. It should not be a normal part of pregnancy, but a lot of people do think, I'm pregnant, so back pain is expected. And this is a myth that I want us to bust this evening. Back pain should not be something that we just take lightly during pregnancy, because it can have a significant impact on people's quality of life, right? And if you think about it as well, 3 years postpartum, you're running around with a toddler, you have to be lifting them up. Yeah, but that's not a time to be having back pain at all. So remember I mentioned before some hormonal changes. My little video box might be blocking, but that is saying hormones. We know that during pregnancy, the hormones are changing in the body. It's preparing the body to grow and expand and preparing the body to deliver baby. So one of those key hormones is relaxin, and it does just what the name says. It's helping the ligaments to relax in the body. Ligaments are the structures that connect bone to bone, and that help to give joint stability. And so when those ligaments start to relax, you'll find that you get more movement in the joints. And this happens in the whole body, even though it's targeted, or the purpose of it is for the pelvis to open to allow baby to come out during birth, right? It's going to start targeting everywhere. So it's targeting the back, the knees. I remember when I was pregnant, I would always bring my ankle because you have less stability there. So this hormone increases tenfold during pregnancy. As I said, causes the ligaments to relax and causes a bit of joint laxity. Laxity means the joints are a little bit more loosey-goosey, and that happens globally. This is why some people may get carpal tunnel during pregnancy as well. No, this can contribute to back pain and pelvic pain. Some people will actually say to me, I feel like when I move around, I can feel the joints in my pelvis and the joints in my back cracking and moving, right? And this, as I said, is a contributor. As you can imagine, there's more movement, there's more room for injury. But research still debates if there's a correlation between relaxing and the severity of back pain in pregnancy. Okay, so that's important to remember, because they're finding that things like stress, actually, so that word there, causes the back pain in pregnancy. Stress. They find that stress is a huge contributor to back pain during pregnancy. And so we want to reduce stress as much as possible. I remember when I was a physio student and we were going around, I did a placement where we would go around and teach a birthing class. And one of the things we would say is try not to have any major life changes during pregnancy. Pregnancy is a big enough life change. Try not to do things like move house, change jobs, because that can add to the stress and add to how your body feels during pregnancy. Stress increases muscular tension for everyone, right? We know if we're stressed out, our neck muscles are going to be tight. Something that's when you feel your back pain even more. Stress, it also increases the perception of pain. So a person who has back pain, two people who have back pain, the person who's stressed out is going to experience or perceive a higher level of pain than a person who's not as stressed. Stress also reduces your quality of sleep. And we know we need sleep to allow our bodies to recover every night. So if you're not getting a good night's sleep, especially during pregnancy, you're going to feel busted the next day, right? So stress is a key factor when it comes to back pain in pregnancy. and then biomechanical and muscular changes, right? So just looking here, we're gonna explore this graphic again soon. But just looking here on the left, we have an abdomen that's not pregnant. And then on the right, we have one that's pregnant, right? So let's look at the one on the left first. I'm gonna use my mouse here. So one of the things I want you to consider, and we're going to discuss this again, is that the core is not just made up of the abdominals at the front. No, when most people hear core, they just think, abs, six pack, yeah. But I want you to consider that your core is much more than that. So yes, we have the abs, the deep ab muscles at the front of the body where the belly button is, in that area between your ribs and your pelvis. But then at the bottom of your pelvis where you're sitting, where you're sitting on now, you also have your pelvic floor muscles. And one of the goals, or one of the functions, I should say, of those muscles is to act as part of your core canister, right? You also have at the top, which is like just under your rib cage, your breathing muscle, which is also part of your core. And then we have the muscles in the back. So this forms kind of a cylinder that helps to keep everything nice and steady, nice and stable. The back, of course, is inherently stable, but the muscles help to add to that stability and that support, right? And if you've ever been to physiotherapy for back pain, that core strength is so important when it comes to preventing and managing back pain. The stronger your muscles are, the less pain you will have. And so if we look over here, where baby is, we can see there's a lot of expansion happening here. We have expansion happening at the front, right? Here of the abdomen. And then baby is putting some pressure on the pelvic floor muscles. So the pelvic floor muscles have a lot more to support. Baby goes up into the diaphragm as well. And that's why people tend to get out of breath really easily when they're pregnant. And so the point I'm trying to make here is that your entire core is being altered and shifted and stretched. There's a lot more strain on it. There's a lot more for it to do during pregnancy. And this is why back pain is also so common during pregnancy. We're gonna look here at another graphic where we can see that as baby grows, right, and the center of gravity kind of changes for a person who's pregnant, you have alterations to posture, right? So posture is key as well during pregnancy. It can affect how your back feels, and it can affect the strain on your muscles. So if we look here, you can see comparing left to right. So on the left, we have a posture that's not the most ideal. There's no such thing as a perfect posture, but you don't want to be in a posture for a prolonged period of time. And if you can see, this person has a forward neck posture, which is going to put pressure on their neck. Their shoulders are going to be rounded, which is going to cause tightness in their chest. I know there's a back pain talk, but just allow me for a second. Imagine if this person now is going to be, if they maybe have a baby already, or they're going to be breastfeeding, that rounded shoulders is going to put more pressure here in the chest area, pain. As you stand in a more, I don't want to use big terms, especially since I'm not there for you to see me, but a position where your tummy is hanging forward more is going to put more pressure on the pubic bone, which is the front of your pelvis, and that can cause pelvic pain. And if right now you sit up in your chairs and you arch your body forward, it's going to put more pressure on your lower back. And imagine you're doing that with more weight in the front. That in and of itself is going to cause back pain. And it's going to cause tightness in those muscles that's going to cause more back pain. So you're stressing the joints and you're also putting more pressure on the muscles. And so posture is so important during pregnancy. And we're going to talk about some exercise. One of the ways that you can maintain a good posture during pregnancy is by maintaining your muscle strength. You want that as these biomechanical changes happen, as relaxing is doing its thing, as life is stressful. So there will be some stress, but exercising is going to help to combat a lot of those. It's going to help to combat stress. It's going to help to build layers of strength so that you can maintain a good posture. If we look at this graphic here on the right, you can see that as she's a girl that's exercising. So she is having her core strength still going. She's still standing upright. She's not going to be having as much stress on her joints and on her back as a person who is standing in a in a posture like person on the left, okay? All right. Now, we're still talking about biomechanical changes and muscular changes. And we're talking here specifically about abdominal separation. Now, don't quote me. I think the figure is like 90 or so % of women will have some kind of abdominal separation during pregnancy. And we expect this because baby is growing and the muscles are going to make space for baby to grow. But as you can imagine, we just talked about how important the core is and how core strength is for supporting the structures in the back. And so as those abdominal muscles separate, that can tend to have a few repercussions, one of which is back pain. And so you want to take care of your core muscles during pregnancy, which we'll talk about soon. You want to make sure you're doing things that protect them and keep them strong. And as we just said, core, don't peep at the slide. There's a good time to close your eyes and remember what I said. Core muscles, abdominals, pelvic floor, diaphragm, back muscles. All of those things are undergoing changes during pregnancy. All those things are stretching. They have more to do. They have more to support. And so back pain can be a byproduct of that, okay? So preventing and managing back pain in pregnancy. Now, when patients come to me and they're having back pain, I love to, of course, listen to them, but then, I move my mouse. Okay, I love to figure out how can we change on what you're doing that's causing your back pain. It makes no sense us doing all this manual therapy. It makes no sense us doing all this exercise and you're still doing day-to-day things that can cause problems and cause dysfunction, right? So remember, I just showed you on the slide before where you have abdominal separation, and I said that we don't want to stress that. So things like getting in and out of bed. So getting in and out of bed, I know most of us do it, we're laying on our back and we just jump straight up in a big sit up. But during pregnancy and postpartum, which is after you've had baby, you want to get out of bed by rolling on a side and then using your arms to push up. If you have pain in your hands, you don't want to push up on the hands, but you want to use your forearms to push you up, right? This is going to help protect those muscles and prevent any what we call doming or coning. Sometimes you're doing something, you see a little cone or dome poking out in the middle of your tummy. You want to avoid that happening. It means that you're straining those muscles, okay? Turning in bed as well. You want to take your time, put a pillow between your knees. Maybe give that pillow a gentle squeeze as you turn as one unit. A lot of times patients come to me and they say, when I turn in bed, it's so painful. And I say, okay, let's see how you turn in bed. And they're turning by turning their upper body and they've left their pelvis facing the other way. And we don't want that. We want everything turning as one unit to keep everything nice and stable and steady. Remember we said during pregnancy, those joints are a little bit more lax. So you just want to keep everything together as you turn, right? Onto your back, catch yourself, and then you turn everything as one unit to the other side. Getting in and out of a vehicle. And this is one that can cause back pain and pelvic pain, especially between the legs. And most people, if we think about how we get into a car or get out, we kind of step one foot out and we're out through the door, putting most of the pressure on one leg, whether we're getting in or out. So during pregnancy, we want to minimize as much of that pressure on one side of the pelvis, one side of the back as much as we can. So you think about getting out of a car, you turn, put both feet on the floor, and then you think equal weight through both legs as they stand up. Getting into the car, you sit first, and then you put your legs in, and that can cause so much relief just with that one tip, right? Navigate frequently used spaces. So I remember I had a patient once, and she said to me, what, my back hurts whenever I take the dog food off of the fridge. And I was like, why don't we put the dog food somewhere more convenient so you don't have to be reaching up there? Put it somewhere at, tummy level, chest level, so you just have to be working with it there. And she was like, yeah, wait, I never think of that. And that solved most of her problem, right? So think about, let me look at my space. Are these places in a place where I have to reach awkwardly and reach up at an angle every evening? Put those things somewhere low down, right? We want to make everything as user-friendly as possible. I know there's a talk on lifting tonight, so use those same tips but also think about the breathing. So plan your lift. Think, okay, I have to lift this thing. If you have especially if you have a toddler already, you want to think, let me make sure toys are out the way, that you don't have to slip, trip. Let me make sure you don't have to make any awkward turns. Let me clear the space first so that this lift is nice and easy. Always think of dividing the lift. So I always tell people, don't come in with the groceries. You're trying to lift in all. You're lifting all 20 bags of groceries. You know, I mean, who's buying 20 bags of groceries now anyway? But you're lifting in all 10 bags of groceries and hurting your back, where you could have just taken 2 trips with 5 bags, right? And then think of breathing. So if you are lifting something, you want to think, how can I breathe to accommodate this lift? And if we exhale, it helps our entire core. So our diaphragm, our abdominals, our pelvic floor, it helps those muscles to move in such a pattern that it helps to support our back and help us to garner the most out of our core when we're doing something like lifting. That also goes to things like pushing a window open, pulling and pushing. Think of breathing out as you do those activities. Standing for prolonged periods. I remember I was given a talk at Lily Plum once. It was a talk about, I think, pregnancy and, pelvic floor and stuff like that. And a lady came up to me and she said, I'm having so much pain on my left, my left lower back and my left hip. And I said, look at how you're standing. I'm sure it's how you're standing in the bank lane. I'm sure it's how you're standing in the supermarket lane. You're standing with all your weight shifted to the left. And so it's important that when we're standing for prolonged periods, especially during pregnancy, due to all the changes that are happening, we kind of keep equal weight for both legs, which is hard. So I always tell people shift from side to side, right? Shift, think about maybe doing some gentle hip circles, but trying to keep your weight even through both legs. And then posture, we don't need to go through that because we went through that on a previous slide. But a good tip is to get someone that you live with to keep an eye on you. You don't know what you look like, you don't know what you're doing, but just getting them to say, look, remember, we try to stand a little bit more upright, maybe sit back and be supported, get them to help you be aware of your body, okay? Because that will help with how your core works as well. Activities to avoid or modify. So if these are activities that you do, these are things that you want to modify. Vacuuming, things that create torque, a lot of torque. Torque is like twisting at the pelvis. If you are vacuuming, try to stick to vacuuming what's directly in front instead of you're facing one way and vacuuming something that's perpendicular and then having to twist. Repetitive, and that also goes for pushing a trolley, a heavy trolley, because then when you have to make those turns in the supermarket, sometimes we tend to turn sharp, and then that can cause some pain, especially on one side. So you want to maybe turn wide when you're turning in with a trolley in the supermarket, or just keep shopping very late, right? Or team up with a partner when you're doing heavy shopping, if you're the person that does the shopping in your household. Repetitive one-legged activities, so things like putting on a pants, putting on a underwear, putting on a skirt can cause a lot of pain as you're standing on one leg to step in. So you can sit, step into the item of clothing, and then stand and lift it up. And the same goes if you were taking it off. Take it off, sit, and then step out of it. Moving items on the floor with your legs is a no-no during pregnancy. Most people don't want to be lifting and bending, so they tend to push things with their legs. And that is a huge, huge, huge cause of back pain during pregnancy and pelvic pain. There are a few things you can also do. So using a pregnancy pillow, which will help to just give a good alignment of the pelvis. Sometimes if you don't have a pillow, you end up having a bit too much internal rotation on the top hip. And so a pregnancy pillow can just help to support your body and make rest much more comfortable. A belly pillow as well. Let me just use my mouse so you can see what I'm saying right here. You can just use a towel and put it under your tummy. You can imagine if all the weight of baby is coming down to one side, sometimes that can strain your back. So a little pregnancy pillow to help support. Supportive pregnancy garments are great. They have to be for pregnancy. So it's just not a random thing that you're buying. A supportive garment for pregnancy that's going to help to give the tummy some lift. And they also have to give some compression to those pelvic joints that might be becoming, as we said, a bit lax and give some support and relieve pain. Kinesio tape is also so great. This is something that I love to use. It helps to not only lift the tummy, but it also helps to give you a little bit more awareness of your core. So then it's going to kick in more and it's going to help with relieving the back pain. This is something that your physio can teach a partner or family member to do for you as well. Prenatal massage is so good. It is really a good tool to help relieve stress, relieve muscular tension, and keep you pain-free and during your pregnancy. Physiotherapy, of course. I could talk about this part all night. Physiotherapy, what is so great about physiotherapy is that we can assess your back pain and pinpoint the source. We're very nosy and very creative. We're going to figure out, okay, this is where your pain is coming from. It might not, it might be something you're doing every day, as we discussed before, teach you how to do it differently. We could figure out, maybe is it a ligament that's maybe not moving as well as the one on the right? You know, we're left moving different to right side. Is it a joint that is a little stuck compared to the other side? Is it a muscle? We'll figure it out and we'll use the appropriate manual therapy and help you to restore balance to your soft tissues and joints, right? And we also can help you to make adjustments to your movement routines, which you said before. And most importantly, we're going to help to encourage movement. We're going to help to promote strength and flexibility, especially in your core. The core is still very important during pregnancy. Most people think, well, I'm pregnant now, so my core strength doesn't matter. No, the core is still very important for, as we just said, you know, maintaining posture, keeping everything supported. And we want your core nice and strong actually to help you push baby out, right? And that is specifically abdominal muscles. We want pelvic floor muscles to relax to allow baby to pass. So just wanted to make sure I made that clear. Movement, sorry, I just saw my computer saying low battery, so I started panic. But anyway, we'll get through this. Preventing and managing back pain in pregnancy. Movement. One of the most heartbreaking things when somebody says to me, you know, I have been exercising all along, but I got pregnant and I stopped. There's no need for you to stop moving during pregnancy. Pregnancy is not an illness. You can still move. There are lots of options. You can do aquanatal. There are aquanatal classes right here provided by a physiotherapist. You can do prenatal yoga. If you were doing CrossFit and running, Pilates, anything before, you can keep doing that once you feel comfortable. Your physiotherapist might help you to modify certain things. They might help you to build strength in certain areas so you could continue doing your tasks. But, you know, of course, listen to your doctor. But some of the worst advice you can get is to stop exercising. Or you want to keep moving, as we said, so your body continues to build those layers of strength throughout your pregnancy to cope with the changes and the biomechanical changes that are going to occur. Movement is going to help to reduce stress. It's going to help to maintain strength and just improve your overall well-being. This lady, I use her at the end of all of my presentations, and I'm going to explain to you why shortly. Back pain in pregnancy, as we know, is very common, but it should not be normalized. Physiotherapy and movement are tools proven to help manage back pain during pregnancy. So the things I want to take away from this, if you don't remember anything else, remember this. Taking back pain seriously during pregnancy and addressing it can help to improve quality of life for years to come. And I find that most people focus on pregnancy, but they don't think about the years to come. They don't think about how pregnancy, how your body feels and what you do with your body during pregnancy and postpartum can affect. Like when you're this lady's age in your golden years, you want that when you're her age, you want that when your colleagues are her age, your sister, your friends are her age, they're still able to bend, they're still able to move, they're still able to live their best quality of life. If you have back pain during your pregnancy, as we said, it's likely that you're going to still have that pain for years after, right? You want to be able to move with your children and with your grandchildren. So please, 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 if you take nothing away from this talk, remember, back pain during pregnancy is very preventable, it's very treatable. My dogs are now joining in, so it's time for me to end this presentation. Have a wonderful evening, everyone. Again, thank you so much for coming out. You can always get my contact information through BPCA if you want to ask any questions. I'm so sorry I could not be there to ask questions and interact with you in person, but still thank you for having me and listening this evening. Have a wonderful evening.
Thank you so very much, Jasmine. Even though she's not in Barbados, she's still here to present with us. Good evening, everyone. I hope that you are glad you came out this evening. Well, I'm certainly glad that you did. There was much information shared, and there was much food for thought. And we hope that you will add all the pointers that you were given to your lifestyle to help kick back pain to the curb and improve your quality of life, because we want to live our best life while we are here. Yes? Wonderful. So, ladies and gentlemen, those who are present here with us at NUPW tonight, and those of you who have joined us online, we want to say thank you so very much for being a part of our back pain lecture. And to our wonderful presenters, all physios by profession, we want to thank you for a job well done. Let's put our hands together for them. I am very pleased to be a part of an organization who places a high value on public education. And that is what we have been doing as an association, because we believe that knowledge is power. And so as we end our Physio Week on this coming Saturday, we want to invite you to visit our YouTube channel, and you can look out there for some wonderful and simple back exercises and stretches to help alleviate back pain. So we invite you to join us. This will be available on Saturday, the 14th of September. And, you know, if there are any philanthropists in the room or on YouTube who are watching, we want to invite you to invest in the Barbados Physical Therapy Association, because an investment in us is an investment in community, it's an investment in country. So we want you to invest in the Barbados Physical Therapy Association. It is the month of September, it's the month of movement, and we are movement specialists, and we encourage you to keep moving, because movement is medicine. Have a wonderful night, ladies and gentlemen. Thank you so much for being a part of our lecture. I just want to make mention of the fact we promised you this on Sunday. At our church service, we said there will be several physios on call, and you can speak to them. Now look for all the young people who are in those blue shirts that say Barbados Physical Therapy Association, and the white ones that say Barbados Physical Therapy Association. If you weren't bold enough to ask your questions on the microphone, find them. It is a September 12th special. Today will be the first and last day of this month that you can get free advice. Just joking. But you can walk up to the physios and you can ask your questions and get some answers if you have any gray areas that you need clarified. Thank you again. Travel safely and have a wonderful evening.